Okay, today I want to talk a few minutes about hepatic encephalopathy. Before I go further, I request you to visit my website at www.drpaul.org. That is www.drpaul.org. We have been posting many videos for physicians preparing for USMLE and PLAB. So please take some time to visit us. So let me talk a few minutes this morning about hepatic encephalopathy. You see, we have so many patients with cirrhosis and liver failure, and majority of patients, they present with hepatic encephalopathy. And if, for example, if you take a patient with cirrhosis or a failing liver, they might get some precipitating causes. First, think about the physiology. The body produces ammonia and it has to be converted into urea by the liver. When the liver does not do its function well, the ammonia is accumulating in the body. And as the ammonia is accumulating in the body, it produces many clinical symptoms. On the other hand, some precipitating causes like constipation, GI bleeding, renal failure, dehydration, infection, surgery, drug exposure, electrolyte abnormalities, hypoxia, dietary protein overload, they can also cause they can act as precipitating factors. You take, for example, constipation. What is happening? The ammonia that is released into the intestines is not being excreted. So as the constipation continues, ammonia gets accumulated in the body and cause hepatic encephalopathy. Now, symptoms and signs. You can say like a clinical grading. Before that, think about physical examination. Physical examination usually reveal the classic signs of chronic liver disease. For example, hepatomegaly, jaundice, sclerolicterus, ascites, asterixis, gynecomastia, spider angiomas. Those are the physical signs of liver failure. Then what about hepatic encephalopathy? To remember easily, they are divided into grade 0 to grade 4. Grade 0 has subtle mental status changes noted on testing of memory, concentration, cognition, and coordination. Grade 1 is characterized by mood disorder, sleep cycle derangement, inattention, difficulty with intellectual tasks. Grade 2 is characterized by lethargy, confusion, ataxia, slurred speech, asterixis, and inappropriate behavior. Grade 3 is characterized by significant confusion, somnolence, delirium, incomprehensible speech, amnesia, hyperreflexia. Grade 4, stupor and coma. So remember, if you remember the clinical grading, what you see is, as we go from grade 0 to grade 4, the clinical features are getting more and more serious. The prognosis also becomes worse as we go from grade 0 to grade 4. Now a few things about laboratory findings. As I said, ammonia level increases. So elevation of ammonia is the characteristic sign of hepatic encephalopathy. But many times you don't see a correlation between the level of ammonia and the severity of symptoms. And a relationship recently has been established between the level of ammonia and the risk of cerebral herniation. So if the ammonia level is high, they can have cerebral herniation. Coming to treatment, emergency department therapy is primarily directed at supportive care and reversal of any underlying conditions. So you give supportive care and you also reverse underlying conditions. For example, the main problem here is to how to remove ammonia from the body. So what should you do? You have to think about a way to remove the ammonia. And ammonia being accumulated in the intestines, you use an agent that will excrete, that causes excretion without causing any other damage. The best medication is lactulose. You can administer it either orally or rectally to decrease ammonia level. And also the antibiotics. Antibiotics like neomycin or metronidazole, they kill the bacteria that produces ammonia. So you are killing the bacteria that produce ammonia by using neomycin or metronidazole. So overall, you can use either lactulose, and you can add an ammonogenic bacteria killing antibiotics like neomycin or metronidazole. The other thing you need to remember is benzodiazepines are contraindicated in patients with hepatic encephalopathy. So remember that whenever a patient has their hepatic encephalopathy and if he has some anxiety, don't choose benzodiazepines because they are contraindicated. Finally, a few words about disposition. You see, everything depends upon the characteristic features like the side effects and the severity of symptoms. So the patient has a lot of symptoms like grade 3 or grade 4, you should definitely admit those patients. If it is their grade 0, just monitor their ammonia level and you can dispose them. So this is Dr. Paul. That's about hepatic encephalopathy. Please visit our website www.drpaul.org, and basically we have been posting videos on our website, and visit us. On the other hand, we are also posting important books for USMLE examination, and we recommend USMLE Smasher. If you are preparing for USMLE Clinical Skills 2, please buy USMLE Smasher. We have given student-to-student advice. Thousands of people are buying this book and getting through their examination without spending a lot of money on live courses. So this book is produced out of live courses at a reasonable cost, and we request you to have a copy of it. Thank you very much.